Hello, my name is Benjamin Linson, and today I'm going to do the Cluster van Rehorst to test for lumbar instability. So this cluster is mainly for testing the lumbar instability and also the ligamental integrity in the lumbar spine. The first test of the cluster is the PA spring test, and firstly I'm going to ask my patient to lie prone on the table. And looking at each segment of the lumbar spine, we're just going to apply some posterior anterior pressure in that direction to each segment, looking for any pain. And starting from the crista iliaca, we know that we can get to the L4, L3, L4, and then start and climb up to L1. And you're going to ask the patient for any pain. Does that feel? Good. Is there any pain?
No.
Any pain?
No.
Great. Any pain?
No.
Great. Patient doesn't have any pain in any of the lumbar segments, but if they were, then it would show some lumbar instability or ligamental disintegrity. The next test we're going to do is a prone instability test. So we're going to have the patient to lie off the side of the bed with their hips at the end of the bed and their legs on the floor. Great. Are you comfortable? Great. And so the first part of the test, we're going to ask the patient to passively relax on the side of the bed and then apply pressure on the lumbar ligaments, starting from L1. Any pain?
No.
Any pain?
No.
No pain? Any pain?
No.
Great. Any pain? No. Alright. Secondly, we're going to ask the patient to lift their legs horizontally, up straight, with straight arms, holding onto the bench, adding the muscular stability of the lumbar spine, and applying any pressure. No, you can relax first, sorry. You're gonna, if there was a pain area, you're gonna focus on that, and as the patient raises their legs horizontally again, you're going to apply the same pressure at that same location, and if the pain diminishes after holding the legs up, then it's a positive test. Any pain?
No.
And you can relax. And we're going to do the third test, which is a general ligament laxity test. If the patient can sit on the side of the bed, we're just going to test the six general areas of ligament laxity. We're going to start with the pinky extension. So you're going to take the patient's pinky and, and it's very, is there any pain? Is there pain now? Great. So you're going to look for anything past 90 degrees, also on the other side. You get pain now? It's a little bit more on the left side than the right side. We're going to move to the thumb to the forearm. And yeah, we're going to go with the patient. We're going to ask the patient to apply this pressure to themselves, to grab the thumb and to apply that, if you can touch it. Great. That seems quite more more lax than normal, and also on the other side. And so the patient can touch the forearm with both, pretty much with both hands, meaning general laxity of the wrist at least. We're going to move on to the knee extension, and then you're going to put the hand on the femur, and you're going to put the knee into flexion. Great. The patient does not exceed 0, so it is not as lax as the others. Same on the other side. We're also going to do the elbow extension, seeing if the elbow can go past 10 degrees, past 0, but this patient can only go to about 5 on both sides. Lastly, we're going to do touching the ground with your hands. So we're going to have the patient standing, and we're going to ask the patient to reach for the floor with straight legs. Can you do that for us? Test it positive if they can get their hand fully on the ground, like so. Great, you can come back up again. That shows general laxity. Great. Lastly, we're going to do an active flexion and deflection. So we're going to ask the patient to slowly reach for their toes again, but also looking for abnormal signs, errant signs of rotation of the hips, or acceleration or deceleration at certain points of flexion, as well as the goer sign of riding the legs when they're coming up or down. So if you can, slowly try to touch your toes. Great. And come back up. Great. That was a very fluid motion, meaning that there was a good lumbar stability. And that was the Cluster van Rehorst. Thank you.